My foundation to ethical clinical nutrition started with my first assignment at Fresenius Kabi. And since then, I've stayed with the healthcare industry, and my last assignment in the industry was with Dr. Reddy Labs, where I was driving the project for starting a nutraceutical vertical within Dr. Reddy's. We did fairly well, but the challenge I faced was that in India, bringing in ethical nutraceutical cannot be done by one or three or five companies. It has to be a national, and if you talk of international, it has to be a global momentum. And that you cannot do it staying in a company. So my next step was moving out of Dr. Reddy Labs to work with Government of India to set up a nutraceutical incubation hub. So you walk in with an idea and walk out with a commercialized product. So the entire ecosystem had labs, clinical trial setup, gamma irradiation center, you name it. So with so much of investment, we certainly saw a lot of influx of innovators, companies, international companies like Korean giants coming down to a small town Vizag in India to leverage the nutraceutical hub there. It was a great success. It is still a great success. It stands to be world's largest nutraceutical incubation hub. But the challenge it faced was no one would travel worldwide to one corner of the country in India to commercialize the innovation. And that is where I again got stuck. And I had to choose my way forward. So I decided to choose a community which had proof of concepts ready. They had clinical validation, scientific rationale, but struggling to commercialize their product. So the learnings from this incubation hub, which is BioValley Incubation Council, I took the learnings from there and digitized it using technology. Today, Nutrify Today platform is the only platform in the world that actually democratizes entire supply chain in nutraceuticals. And today, a genuine innovator has an opportunity to connect with the topmost commercialization firms across the world, showcase their innovation, and get commercialized. And it's no more just an idea. There's a platform, there's success stories. The largest great inspirational success story that I often cite is a research scientist in Ayurveda in a small town in the suburbs of Guntur in South India, struggled for 30 years with his research work, except for awards and some revenue that he might have generated, couldn't do much. Thanks to this technology at Nutrify Today networking platform, he got connected to a large distribution company in Switzerland who owned up the entire research work, repackaged it, and commercialized it in US. A success story of NanoVeda in US is an innovation which has struggled for 30 years, and one technology has gone global. Okay. So this is the finest success story. And when I say 30 years of research, not only the ingredient research, tremendous amount of clinical studies to back it up, but no connects to get it commercialized. So this is what we have achieved with Nutrify Today, and that's why we say we have democratized the entire supply chain. As the term catalyst means that if there are two potential points together, they will get into some transaction because of presence of catalyst, right? So what we have tried to do now in this journey, and now that we are Nutrify Today, and I'm the chief catalyst here, we are trying to open up all possible doors. So when I say democratize, we also have to make sure that there is a catalyzation of the process. For example, just because I connect you to a very senior new product development head in a very large company doesn't mean business. He or she may still not respond to you, right? So what we did is we went ahead, invested in one of its kind technology, and very happy to share with you that now Nutrify today has launched Nutrify Genie, which is world's first artificial intelligence engine that helps these big companies ideate to commercialize so basically ideation to commercialization of differentiated ethical nutraceutical portfolio at half the conventional time. So you don't only save time and money for go to market, but you also have the leverage of depth and spectrum of options. If your innovation team could do 10 innovations, I can talk of 100 innovations, thanks to 1.2 million data points that's sitting behind Genie, right? So now what is happening is that when these large companies start using the platform for ideation, the platform starts generating ingredient and research leads for the small suppliers. Because a large player is bothered about what can I launch, how can I get my P&L activated as soon as possible. That's the priority number one. The engine, while serving them, generates business opportunities without declaring the person who's looking out for. But now an innovator, if they have got something to offer in this ideation process, can actually have the innovation uploaded onto a platform. Our innovation, bots go look at it and then plug it into the innovation portfolio. So now it's a global portfolio offering, right from anywhere across the world coming in onto your design table. So that is the level of catalyst work that we're doing. And by catalyzing the ideation to commercialization using Nutrify Genie, we have further catalyzed and expedited the process of supply chain democratization. At this stage, Nutrify Genie works with, so we have mapped 11 countries. So right now, the Genie has mapped out all 11 regulators. So when you start designing a product, the Genie tags into the database of the specific regulator, makes all possible correction on the design work that you're doing, so that from day one you're regulatory compliant. Okay, so usually what happens, first you come up with an idea, you try to put a formulation concept note, then you check whether it will get approved by, first of all you check whether your product innovation is compliant to science. So do you have clinical support system behind it? And if you've got that, then are you even compliant to your local regulatory? That's truly a 6 to 8 months of work, any company. Now, how does it sound like this 8 months, I do it in 2 hours? Okay, because all this data is real time available, and all you need to focus on is, okay, fine, you want to get into bone health, and this Genie is suggesting go for these ingredients for this market, and as Genie is suggesting, it's auto-correcting the dose so that you don't have to go and again validate it. You may do it. So even if you get into revalidation, it's still better. You may end up spending 1 month, but 1 month is super better than spending 8 months to 1 year, right? So, and then this is super sure, and you can do multi-country launches. That's the advantage of Genie and regulators fitting into this whole scenario. The clinical papers, the 100, sorry, so that's a million, yeah, so over 1 million clinical papers, right? That includes both nutraceuticals and drug. And the Genie reads all of them to come up with a rationalized approach rather than just going to, oh, okay, curcumin is good for anti-aging, so have it. No. If it is anti-aging, it will also go and check what has happened in the drug world, what was the mechanism of action that they took. Can they map the learning from that into the nutraceutical world and suggest, hey, why curcumin? You might as well have astaxanthin. Just putting a context to it, because you will get following output. It follows this mechanism of action. This is well proven, better than curcumin. Okay, just to put a context to the whole story. So that's the beauty of Genie. Science validation, regulatory validation, real time.